welcome back to my channel. My name is Shamika and this is Check the Rhymes. November is Pancreatic Cancer Awareness Month, and it's been exactly 1 year since we lost the legendary Alex Trebek to pancreatic cancer. So joining me today to talk about such an important topic is the Pancreatic Cancer Action Network's President and CEO, Julie Fleshman. We're going to be talking about what the organization is doing to raise awareness and the symptoms that you can look out for early detection. So stay tuned because you definitely don't want to miss today's show. Good morning, Julie. Welcome to Check the Rhymes. How are you?
I'm good. Thanks so much for having me.
Absolutely. So this is an important topic, and I was just curious, are there symptoms that one should look out for to kind of help with that early detection of pancreatic cancer?
Yeah, so one of the problems with pancreatic cancer is there is no early detection test, and the symptoms are quite vague, benign symptoms, things that we experience with lots of different diseases and might not necessarily think this is pancreatic cancer. So we want people to understand the risk factors and symptoms of pancreatic cancer so that they can be more aware and be good advocates with their doctor.
Okay, can you tell us what any of those things that they should kind of look out for are?
Sure. So some of the symptoms of pancreatic cancer are things like back pain, stomach pain, jaundice, the yellowing of the skin and the eyes, new onset diabetes, and people can go to PanCAN.org to see a full list of the symptoms and the risk factors.
Now, you mentioned there's no test for early detection, kind of like, how we go get mammograms to detect breast cancer. So once people go to the doctor with these symptoms, then how are they tested to find out if it is pancreatic cancer?
Right. So once somebody has the symptoms and the doctor is trying to determine if it's pancreatic cancer, they may have a CAT scan, they may do an endoscopic ultrasound in order to get sample of the tissue in the pancreatic, in the pancreas in order to test it. And what we're talking about this month during Pancreatic Cancer Awareness Month is testing for patients once they are diagnosed. PanCAN recommends that all patients get genetic testing and biomarker testing of their tumor to determine the best treatment option for them. And we also recommend that those family members of a first-degree relative of a pancreatic cancer patient consider getting genetic testing to better understand their risk of developing pancreatic cancer.
Now, I understand that some people tend to be scared of finding out that if they are at risk, you know what I'm saying? So what would you say to those people that it's okay to go and get the genetic testing? Because, sometimes they're just like, if I don't know, I'm okay.
Yeah, PanCAN believes that knowledge is power. And so we are encouraging people to talk about testing, to talk with their family members. Family members of pancreatic cancer patients should consider talking to a genetic counselor, and that genetic counselor can then help them look at their family history of cancer and whether genetic testing might be right for them to better understand their pancreatic cancer risk. And people can go to PanCAN.org to find our family history worksheet that they can fill out that would help them then have a conversation with a genetic counselor.
Okay. Great. And how can people donate to your organization?
So people can go to PanCAN.org to learn more about pancreatic cancer and about testing as we're talking about today, but also how to get involved and how to make a donation. Those donations really help us fuel research, invest in research that is finding early detection strategies and better treatments for the disease.
Thank you so much, Julie, for coming on today to talk about such an important topic. Everybody, you heard her. Go to the website, find out all the information, and donate and get involved. Thank you so much, Julie, for joining me today.
Thank you. And people can also call our patient services program, which is free of charge, and get more information through our trained case managers as well.
Perfect. Thank you.
Thank you.